Next generation sequencing, or NGS, can be used to help us determine if the patient has specific biomarkers we can identify and use to target for treatment. Certain findings can tell us if a particular treatment might work for that patient, and we can see if there's any genetic variants that we might have a biomarker targeted agent to use to treat them with.
You're listening to the ONS Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between.
Hello, and welcome to the ONS Podcast. I'm your host, Lenise Taylor, Oncology Clinical Specialist at ONS, and today we're talking with Jackie Peterson, an ambulatory nurse manager at University of Chicago Medical Center in Illinois, about prostate cancer and biomarker testing. This podcast is sponsored by AstraZeneca and is not eligible for NCPD credit. ONS is solely responsible for the criteria, objectives, content, quality, and scientific integrity of its programs and publications. Thanks for joining us today, Jackie.
Thanks for having me. I'm really excited to be here.
To get things started, what are some of the risk factors for developing prostate cancer, and is it hereditary?
Some of the risk factors for developing prostate cancer include age, race, family history, and certain genetic changes or variants. Prostate cancer has some hereditary component, but most prostate cancer occurs in men without any significant family history of it.
Can prostate cancer be prevented?
Most of the risk factors for prostate cancer are non-modifiable. That means that it's very difficult for us to prevent this type of cancer.
If they're non-modifiable, how is prostate cancer typically detected and diagnosed?
Typically, we detect prostate cancer through routine screenings such as prostate-specific antigen testing or PSA testing or digital rectal exams. Elevated levels of PSA in the blood can increase the chances of having prostate cancer, and further testing may be needed, including biopsy to confirm diagnosis.
What diagnostics are used to determine the aggressiveness and the need for immediate treatment versus something that you can just monitor and watch and wait?
Imaging tests are really important. So that would be like CT, bone scans, MRIs, PSMA PET scans, and blood testing, biopsy results are all used in combination to really determine the aggressiveness of the cancer and whether or not we need to treat it right away. Observation, or what we call watchful waiting, really relies on changes in symptoms and may be a good option for men that are older or men that have other serious health problems.
Things where you may not want to jump into treatment right away. That makes sense. What type of routine imaging is used for prostate cancer?
CT scans, bone scans, MRI, PSMA PET scans are the most common types of scans that we use for imaging for prostate cancer.
You mentioned PSA earlier. What other type of biomarkers are monitored for prostate cancer?
Key biomarkers include PSA, like I mentioned, and prostate cancer gene 3, which is PCA3, and prostate-specific membrane antigen, or PSMA. Other biomarkers that are important for us to test include BRCA1, BRCA2, and Lynch syndrome-associated genes, which are MLH1, MSH2, MSH6, PMS2, and EPCAM. A lot of letters there. Biomarkers can be collected via your blood, urine, saliva, or tissue samples. So these are different ways that we can test and look for biomarkers in our patients.
Wow, that's a lot. So PSA would be what you would use to diagnose, and then you would go into the other biomarkers if their PSA was elevated.
Although it can be one of the determinations of whether or not a patient has prostate cancer. It's not solely the only thing we look at, because elevated PSA can be caused by multiple other factors. So we do also look at other biomarkers and then also the diagnostic testing. So imaging is really important. Symptoms are really important. And then ultimately a biopsy if we determine that the prostate is enlarged or we see something on imaging.
You talked a little bit about how these other biomarkers can be collected in a variety of ways. When are they collected and how do they impact treatment?
For most of our patients, we like to collect biomarkers right away. So we look at biomarkers pretty much routinely throughout their treatment. And then we also look at before they start any kind of treatment. So typically when a man is coming into his doctor's office or urologist or coming to see us, we check PSA almost every single time that they come. Other biomarkers, the other ones that are maybe not so easy to detect, BRCA1, BRCA2, and the Lynch syndrome genes, we usually send those out to companies or use that from their tissue samples to make determinations. So those are a little bit harder and more time consuming. So we don't test those as frequently. And typically, especially for germline testing, that's not going to change. So when you have genetic testing that's done on the germline, that really means that we're testing for things that are inherited or that come from your parents. So when we look at that, those things aren't going to change over time. That's kind of like a one and done situation. We kind of look at that. Initially, we test pretty much every metastatic patient at the time of diagnosis of metastatic disease for any germline variants. That's the only time we test them. And then we'll test for tissue samples if they do a prostate biopsy or prostatectomy, which is the removal of the prostate. They'll test the tissue to determine if there's any somatic or tissue-based biomarkers that we can look at to make treatment decisions.
So the treatment for that cancer might vary dependent on what type of biomarkers are present.
Correct.
What are some of the more common treatments or therapies used for prostate cancer?
The treatment really varies depending on the risk, stage of disease, and life expectancy. Most of our patients are going to be on some type of androgen deprivation therapy or ADT, along with maybe some additional therapies. Some of those other therapies include radiation, androgen receptor antagonists, chemotherapy, surgery, immunotherapy, and radioligand therapy. So for patients with more localized disease and a greater survival expectancy that are symptomatic, we might decide to do ADT alone. And then for patients that have metastatic disease, we'll do a dual androgen receptor blockade with or without chemotherapy for those patients.
So we can pretty much use anything for these patients, just like so many of our other cancer types now. Does the difference in the therapies also vary based on how advanced the disease is?
It does kind of matter a little bit about how advanced the disease is. Usually for our castrate sensitive patients, they respond better to androgen deprivation therapy because that really is slowing down or reducing the growth of the cancer by reducing the available testosterone that the cancer needs to grow. Whereas our patients that are more advanced and have castrate resistant prostate cancer, that cancer will continue to grow despite having the lowered testosterone levels. So they might need additional layers of treatment to really get their cancer under control.
If a patient has more advanced disease, can you tell us about how we would use the next generation sequencing and how it might affect treatment?
Next generation sequencing or NGS can be used to help us determine if the patient has specific biomarkers we can identify and use to target for treatment.
Are there any particular findings that would impact treatment?
Absolutely. Certain findings can tell us if a particular treatment might work for that patient. And we can see if there's any genetic variants that we might have a biomarker targeted agent to use to treat them with.
So thinking about that biomarker testing, how do you explain that to patients and how do you explain how that affects their treatment options?
When I talk to them about biomarker testing, I just tell them it's another tool in our toolbox that we can use to help us determine if they might benefit from other therapy options now or in the future. I tell them that sometimes we'll get a report back with a variant of unknown significance. And basically that means that we don't really know whether or not this has an impact on their health or risk factors for the disease. So that can be sometimes a little bit of a concern for these patients. So we just have to reassure them that we're continually doing research around biomarker testing. The science is always advancing. So if there is something that they find in the future, we'll definitely make them aware of that.
I can see where that would be concerning. What are some of the other common concerns that patients have about biomarker testing?
Some of the other common concerns surround confidentiality and costs. When we do genetic germline testing in particular, this tests for the variants that might be inherited. So that comes from parents or that might be passed on to your children. So this could cause some concerns, as we usually would recommend cascade testing for their siblings and children of the impacted patient to evaluate the risk that the children might have of having cancer or their siblings of developing cancer sooner. Some patients might not want their families or children to really know that they have cancer, so they might not feel comfortable disclosing that.
When might a patient be offered a clinical trial?
In my practice, we try to offer clinical trials to any patient that might be eligible for one. There's trials open for every phase and every stage of the disease process. So there's really a lot of opportunities for men to get involved if they're interested in clinical trials.
Where could a person learn more about what clinical trials are available for prostate cancer?
So there's two websites that I typically recommend people look for, and that's clinicaltrials.gov and zerocancer.org. Zerocancer.org is really a great resource for prostate cancer. It is prostate cancer specific. So it really has a little bit more detailed information about what's available specifically for prostate cancer and some resources for patients as well.
What a great resource. I've never heard of that one before. So what other resources are available to help patients understand more about prostate cancer and about biomarker testing?
Zerocancer.org is really great. Like I mentioned, and American Cancer Society is a great resource for patients to review information about biomarker testing, different types of cancers as well.
What resources are available to help nurses learn more about this topic?
ONS has a great biomarker resource available for nurses. I've been a part of the biomarker database for a while and helping expand our database. So this is a really great resource for our nurses to look to, and really has a lot of really great tools and classes and things available.
I'm a little biased, but I agree. I have a couple more questions for you. What type of hidden or implicit biases might a healthcare professional need to be aware of that would impact biomarker testing and treatment for prostate cancer?
I think one of the biggest topics or things that I think about is the inequity that exists in biomarker testing and research in particular, especially surrounding African American population. When these tests and things were developed, that population really wasn't studied as much. So really there's not a lot of good data yet to make a decision or impact on those patients in that population. So it can have a little, I guess, hidden bias because we don't really know what's going on. So I think self-reflection and education for healthcare professionals and focusing on the health equity and really trying to get African American and marginalized populations to consider clinical trials and enroll in these trials is really important so that we can further advance the science.
That's an excellent point. The focus has been on the white population, and we need to definitely include and expand access to these trials. What are some common misconceptions about biomarker testing for prostate cancer?
Some common misperceptions are that high PSA definitively indicates cancer and that biomarker testing is only for advanced cancer. While PSA is used as a tool, it's not foolproof indicator of a cancer diagnosis. And biomarker testing can be used at any stage of the disease and is a really useful tool for treatment.
What's something about the topic that's not often discussed, but you wish people knew more about?
I think that goes back to the question you asked earlier about the hidden bias. I think healthcare inequity is really something that people aren't talking about with testing and biomarkers in particular. So this is something that I really am passionate about and want people to start incorporating more into their practice.
Very important. Along with that, what's some additional training or education that oncology nurses need to stay current on this topic?
Just keep learning about changes in the research and utilizing the tools that are available, especially like the tools that are available on the ONS website, and learn how to advocate for patients in getting them tested and working with their providers to really facilitate that.
In addition to the resources you mentioned earlier, are there other resources that you would recommend for patients or providers who want to learn more about this?
I think, like I mentioned, the American Cancer Society is a great resource. There's a lot of resources out there available for patients. zerocancer.org. NCI is a great resource. NCCN, another really great resource. So there's a lot of information out there and available for patients and providers.
It's a really good point. I think a lot of people forget about NCCN and their patient-facing materials that they have as well. Jackie, it's been great talking with you today. Do you have any other final comments for us?
Just wanted to really thank you guys for having me on today and really appreciate getting the chance to talk about this patient population and the importance of biomarker testing for these folks.
Thank you so much.
Thank you for listening to the ONS Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.